Hi! Welcome to this small talk from me, Annette, at Harmonious Birth. Today we are going to talk a little bit about postpartum hemorrhage, or translated into bleeding after birth. And this is something that is very rare if we are letting the body be undisturbed and we have a completely normal, undisturbed physiologic birth. It's a little bit more normal in surgical births or in births that are chemically induced and augmented by synthetic oxytocin. And it's a little bit more normal in other third world countries where they don't have access to that much health care and good help, blood transfusions, and close by hospitals that we have. So, but anyway, that's a question that lots of people ask. It's like, what if I bleed too much after birth? What happens? So first of all, we just need to quickly understand what a normal physiologic birth is. And the third stage of the normal physiologic birth is when the baby is born and we're waiting for the placenta to come out. And by this moment, your body is flowing over with hormones, and if you are left alone and undisturbed and bonding with your baby skin to skin, the normal physiologic process would be that the uterus would continue to contract. And by this contractions after birth, the blood that is still left in the placenta, which is like almost half of the baby's blood volume, because in the womb, of course, the placenta and the cord is also parts of the baby. So when the baby is born, half of its blood is still in the placenta. So after birth, we call it the placenta newborn transfusion. And that's when the blood from the placenta gets pulsated into the baby, and the placenta is giving back the blood the baby needs to have its full blood volume. And in this blood, it is pH balanced, it's full of oxygen, it's full of nutrients, iron, and stem cells, which is all things that the baby needs. So here we talk about early and delayed cord clamping, which is something that in another YouTube video I talked a little bit more closely about this, so check that out if you are curious. But this transfusion is something that would take from 3 minutes until several hours. And this is when it's not just the blood coming from the placenta into the baby, it's like the baby also sending blood back to the placenta and equilibrating the blood volume in its own body. So with this blood, it perfuses the baby's lungs and organs, and this transfusion is very, very important for the baby. All in all, the lungs, the organs, the brain, and everything the baby needs to come into this world in a better way. So it's very important that we leave this process alone. And of course, all the love hormones in the air, the oxytocin, will keep this uterus contracting. So the placenta will send all its blood to the baby and start to shed off the uterine wall. And in this process of the uterus contracting and the placenta starting shedding, like all the blood vessels that's in between the uterine wall and the placenta is like closing off. So because it's like a huge wound really that's happening there, and it's very important that we leave that process alone so that the blood vessels can close themselves up and we don't have that bleeding. So if we leave this process alone, we leave the placenta alone, the uterus continues to contract, sheds the placenta comes out, we leave the placenta intact in a bowl next to the baby, so this transfusion can go as normal and continue as long as it's possible, or until it's finished, of course, which is the best. And that can take a couple of hours. And you can feel the pulse, not just pulse on the cord when it stops pulsating, but pulse all the way into the umbilicus of the baby. And when this pulse is stopped, then it's very then the process is finished, and you don't even have to clamp the cord because there's no bleeding happening from either the baby or the placenta. And this is a very important process. And when we let this unfold naturally, then we very seldom see bleeding. But of course, there could be bleeding. I mean, it's not very often. What's normal is to bleed about like 500, up to 500 milliliters of blood in a normal birth, and up to 1,000 milliliters of blood in a surgical birth. But this also depends on, has the mother had a good nutrition through the pregnancy? How is she feeling? Is she feeling fine? Is she feeling dizzy, weak? Is she like showing early signs of shock, that she's like getting pale and she doesn't communicate, you can't get into contact with her? So this depends, like, has the woman like built up a good blood volume through pregnancy? She can lose more blood than a woman that has had poor nutrition and maybe doesn't have the possibility to lose so much blood. So it's also depending, the postpartum hemorrhage is like not just in the milliliters, but it also like, how is the mother doing? So the midwife will check if like, have the placenta come out. If not, she will try to facilitate that the placenta comes. And this is by giving the mother some herbs, trying to get the uterus to contract, and getting the mother, if possible, up into an upright position, and see if she can see signs of the placenta separating, like a gush of blood, the cord lengthening. And if she sees this, maybe she will gently pull on the cord to see if the placenta just comes easily. And if you have tried all the different things and it's still a trickle or a flow of blood and the placenta is not coming, that's a very good reason for transport, and most likely your midwife has called for transport way before this has already happened. Because if there's a steady flow of blood or a trickle that you can't really understand where it comes from, and the mother is showing signs of shock, call EMS, and then they're on their way. Maybe you manage to resolve the bleeding underway, but anyway, it's good for help to come. So reasons for the placenta to not maybe come is that it could be like just stuck in there, and somehow there are lots of clots, and you really need to see if you can get it out by standing up, or if you have had placenta previa, which is a placenta which is like in front of the cervix or down by the cervix, that could cause a lot of bleeding. And then there's very rare, but sometimes the placenta sort of grows into the uterine wall, and that we call placenta accreta. And it's very rare, but it can happen. And that needs for surgical removal. But don't think about that, because most likely it's not happening to you. But it's a reason why the placenta won't come out, and you transport to the hospital and they remove your placenta surgically. If the placenta is out, the midwife will try to give you some herbs and massage the uterus gently to see if she can rub up a contraction. There would also be, the best thing is to be skin to skin with the baby and have the baby to the breast. And breastfeed the baby. If not, nipple stimulation is a very good thing to get the uterus to contract. And the uterus can be tired, after a long birth. If you have had a very long birth or you had a very long pushing phase, or if you're in the hospital, you've been induced and augmented by Pitocin, your uterus get atonic, and then it gets sluggish and boggy and doesn't want to contract really. And then we have to help it a little bit contract. So we can massage the uterus, give herbs, and sometimes just holding the uterus sort of with our hands from the outside can help the uterus like slowly starting to contract. Your midwife would, of course, all the time assess the bleeding. Is it like a steady flow? Is it like a trickle, just like coming a little bit from a laceration from your perineum or the cervix? She would hold pressure on the laceration, and if the blood flow is sort of just, you can't understand where it comes from, it's a good sign to call for transport and to go in to the hospital and see if they can resolve the matter, if it's need for blood transfusions. And before this, maybe also the mother shows signs of shock, and it can be good to get help. But very often the bleeding will be resolved by mom maybe getting up to pee. That's very important to empty the bladder. Maybe when she pees, there has been some clots inside the uterus that sort of comes out when she pees, or the midwife can try to get some of the clots out from the uterus. So these are all things that can prevent the uterus from contracting, the full bladder, the clots inside. And very often when the clots come out, or you have emptied the bladder, or there was a laceration and she keeps pressure on it, or she massaged the uterus, the bleeding would stop. So very rare, there is some people having clotting disorders, so the blood will not coagulate, and that's also when the blood is very thin and just flowing, and you would definitely call for transport when seeing that no other measures is helping. You would probably have to lay down on your back, keep your feet a little elevated, have a good warm blanket over you, have your baby skin to skin. Your midwife would talk to you. It's good if you can talk to your baby while we're trying to resolve the bleeding. And of course, get some fluids, not just water, but some warm fluids with some sugar or honey in it, and some salt to get your fluids rebalanced. And in the hospital, if you go to the hospital, you would probably get an IV with fluids as well. So this sounds very serious, but sometimes it is serious and we have to go to the hospital. But very often it solves itself by small measures, but it's always to be taken serious. And if you are having multiple pregnancies or twins, or it can be a risk for postpartum hemorrhage. But it's also ways to prevent postpartum hemorrhage, and it's by having excellent nutrition during your pregnancy, to make sure that you're eating enough and that you're eating healthy, fresh, nutritious, whole food, like real milk, real meat, liver, and fresh vegetables, dark green vegetables, everything that's nutritious for you. And this will build up your blood volume, so you have a good blood volume. And when you have this blood volume already built up during your pregnancy, it's most likely you will not bleed as much, but you can also afford to bleed a little bit because you already have built up a reserve within your body. So, and of course, having a normal physiological birth as undisturbed as possible and leaving the body alone, leaving birth to be undisturbed, and the third phase of the birth to be holy, and the birth of the placenta to be something that just takes its time, and the newborn placenta transfusion to finish up, and there will be probably not as much bleeding. So I hope that today you learned something. If you want to dive deeper into delayed cord clamping, there is another video here on YouTube that I made about that. And hope you have a wonderful day. And don't worry about postpartum bleeding, but now you know a little bit more. Have a good day.